you, Madam Deputy Speaker, and it's a privilege to stand here and speak in this debate today. The points that have been raised from the front bench eloquently earlier and by other colleagues, I'm sure throughout the rest of this debate, will be covered in detail about what was covered in the budget, and I was particularly pleased with Warner Brothers Leavesden in my own constituency for the benefits that were given and the support to ensure the film industry would thrive in this country. But I will focus today on productivity, both by trying to keep my speech short and also by focusing in on one particular point, which is a particular area of passion for me, which is around the support given around the NHS and technology. As has been reported, the NHS Chief Executive has acknowledged that the significant investment to fund new technology will unlock tens of billions of pounds of savings. But there are areas that I think are so important that we look at with regards to this investment. In particular, when we look at the role of digital and the role of technology within the health arena. In Watford, at Watford General, I was very proud to visit on several occasions the virtual wards and the virtual hospital that the team have been developing there. In fact, they've been groundbreaking in their work in this. And what that means is that patients, especially during COVID when this initiative started, were able to be at home, to be looked after in their own space with their family around them than necessarily being in a ward. That, of course, from a NHS perspective, freed up beds, freed up nurses and doctors' time, but also meant for the patient they had the ability to have the comfort of their own home whilst knowing that the technology was there to support them and ensure that they were being monitored and watched with the best possible devices. There's also amazing work that I've seen at Watford with regards to robot-assisted surgery. And as I understand it, the work that goes on in that actually can lead to quicker results with regards the ability for people to heal, but also ensures that the surgery is literally precision. And I had the opportunity to use one of the machines a while ago, and it's absolutely incredible the level of accuracy that's possible through this technology. But where I'd really like to focus is on the role of artificial intelligence, and I will make a few asks. Perhaps the Minister might not be able to respond to these because I appreciate they might be more within the health arena themselves in the Department of Health. But I think when we look at digital health, it's so important to make sure that we see the benefits of what may come, but also the benefits that are here already from the learnings, as I've mentioned. I think one of the key areas, is about making sure that we use this rise of AI within healthcare, both with the benefits and the opportunities, but also be mindful of the risks that this might bring. One of the risks I see is an increasing area around the digital divide. And what I ask is that when we put this investment into the NHS, this investment into technology, that we don't have a growing divide of those who have the ability to use the technology and those who have not. And what I would ask is that when we're developing these, we don't just cut off the ability for those who want face-to-face support, those who want to be able to go in and see a receptionist or a person face-to-face, that we actually use the extra time that's given through those who are using technology to provide access and the extra time to the face-to-face who need that support. In addition, I think there's a great opportunity here for a scheme that I've proposed before, but I don't know whether I have within these benches, which is the idea of a data donor scheme. At the moment, sadly, when somebody passes away, they may be able to save other people's lives through organ donation. Now, every single day, many of us have these various Apple Watches or Fitbits or the ability to collect data that will no doubt be invaluable with AI and our ability for GPs to diagnose issues and for clinicians to use that. But I think there's a great scope within this investment to look at a data donation scheme. Imagine if each of us were able to anonymously donate data around our heartbeat, around our health attributes, perhaps when we've taken a particular new drug, to be able to share that data anonymously with the NHS, which could then be used as part of clinical trials and research. I think it could transform the way that we look at curing cancer, looking at finding a new way to help the health of the nation, but also identify potential risks that we may not have seen before. And I think it's a great opportunity with this incredible investment, along with the, I believe, £100 million investment that's gone into the Turing Institute to look at how we can use AI in a better way. The other area I think is so important as well is about how we educate the public around the use of AI and data. But one of the things I'm really conscious of, and I've spoken about from these benches before, I know I'm trying to keep to my productivity, as my honourable member has reminded me. The other area that I think is so important is making sure that people know when they're using this technology. The rise in chatbots, the rise in AI tools that are perhaps pretending that they're human when they're not, it's essential that the public know when that's being used. And I would say that any government system and any NHS system should have a very clear watermark or notation or reminder that they are not speaking to a human being, but they're actually using AI. And I think that will help demystify the use of technology. It will also make people feel more comfortable, but also make sure that they're aware when those who don't want to use it for good reason are tackled. So I would say I hugely welcome this budget. I think the tax cuts have been essential. I think the government benches, I know, and everyone on this side of the House is keen to make sure we reduce taxes. So I'm keen on that. I'm keen on the benefits that we've seen. But I think within the technology space, let's make the most of it. Let's see the benefits and help the nation become healthier and happier for it. Thank you.